Following occlusal trauma and infracture of the root, tooth 4-6 can no longer be preserved and will be removed. The gap will be restored as follows by transposition of the impacted wisdom tooth 4-8. Especially in teenagers, wisdom teeth whose roots have not yet finished growing are highly suitable. The conditions are favorable for transposition when the roots of the tooth to be transposed are already about 2/3 developed and the tooth can be removed gently. First, tooth 4-6 is removed carefully, without fracturing the buccal wall of the alveolus. The ligaments must therefore be divided carefully beforehand with a periosteum, and the tooth dislocated before the actual extraction. It is then dislocated slowly and carefully with an extraction forceps in order to give the bone time to stretch as necessary. In this way, root fracture and the need for osteotomy are avoided. Following the extraction, the base of the alveolus is curated thoroughly. The interdental bone septum is then drilled out. The future alveolus is adapted to the size of the wisdom tooth that is to be transplanted. The correct size of the alveolus is assessed primarily from experience, but also by measuring the radiograph and transferring the measurements with calipers. After the alveolus has been modeled, the wound is treated with a cross suture and swab. A stable clot is important, as this ensures the development of well-perfused granulation tissue in the alveolus within a week. Systemic antibiotics are not required postoperatively.
Langsam schließen und zubeißen.
After a week, the extraction wound is healed and filled with well-perfused granulation tissue. The highly vascular granulation tissue improves the chances of healing considerably, as it enables rapid vascular attachment to the periodontal ligament and pulp tissue. Before freshening the first molar alveolus, the first step is to expose wisdom tooth 4-8 with the burr and dislocate it with a fine elevator. With the forceps, the tooth is replaced again, as the nutrition of the tooth in this natural bed is not interrupted.
So, dann setze ich ihn erst noch mal kurz zurück. So. Und hier.
The first molar alveolus is then prepared for transposition. The edges of the alveolus are incised again, and the alveolus is freshened with a curette. The actual transposition of the wisdom tooth is now performed without much delay, as the sooner the periodontium is supplied again with blood, the higher the chances of healing. If the alveolus is the right size right away, the tooth, as shown here, can attain such primary stability that complex splinting is not needed.
So. Wunderbar.
The transplanted tooth should also be in so-called infraocclusion and not be loaded by the antagonist. In the functional phase, the transplanted tooth will arrive in occlusion again on its own. After transposition of the wisdom tooth wound itself is closed with 2 interrupted sutures.
Ja? So, gut. Dann langsam schließen.
The X-ray shows the highly damaged tooth 4-6 and the unerupted wisdom tooth 4-8. This still has a broad apical foramen, which is of crucial importance for revascularization. Radiographic appearance following transposition. The bone space beneath the roots is filled with highly vascular granulation tissue, which should enable secure healing of the roots and thus revitalization of the pulp. After just 10 days, the transplanted tooth already demonstrates relatively high intrinsic stability. However, the tooth achieves adequate masticatory stability only after 6 weeks.
So, gut. Dann langsam schließen. Schon relativ fest, ne? Und? Ja. Gut.
At interim follow-up, it can be seen clearly how the transplanted tooth has emerged from its new alveolus and has sought occlusion contact with its upper antagonist. 6 months later, the periodontal tissues are free from inflammation, and the transplanted wisdom tooth 4-8 is firm and not sensitive to percussion.
Den Zettel vielleicht nochmal. So, dann beißen Sie mal langsam zu.
Undisturbed occlusion contact has already occurred on neutral occlusion. Grinding of hyperbalances or early contacts was no longer needed. Repeated vitality testing was also positive.